You're watching North State Health, the North State's first local health program.
And we are back with Dr. Ray Powell from Physicians Plan Weight Management. Our topic today is talking about obesity. And doctor, let's talk a little bit about how big of a problem is this? Is it truly an epidemic, and is it getting worse?
It truly is. It's more than doubled in the last 20 years. And really, when you look at the statistics, over 400,000 people in this country are dying just directly related to obesity as a disease every year in this country. And you see it every day in the press. You see all the different magazines. They talk about childhood obesity as well as adult obesity, and it just causes so many other medical conditions that are worsened. And if you get the weight under control, a lot of times those disease processes like hypertension and diabetes actually diminish.
And you were saying earlier before the show, I think, that you know, Americans, we always want to be number one, we want to be best. Well, we're number one, but we shouldn't be. So.
Exactly. On the next slide, we show the different countries, and it's really the top 10 countries and the prevalence of obesity. It's 30% of the American population is not overweight, it's obese. About 60% are total overweight. And you can see Mexico, England, United Kingdom, Greece, Australia, and now it's rampant into the Middle East as well as into Australia. Okay. It's really a major epidemic that's becoming a pandemic according to the World Health Organization. Okay. And this next slide shows a progression of the disease of obesity as these colors go, the light blue, the dark blue, it's getting beyond into the deep south where there's more and more obesity, up to 10 to 15 to 20%. Into the 90s now, we got a new color, which is greater than 20%. Now you can see it just almost spreading like the flu across the country. Now there's even a higher percentage of 25% in the deep south and industrial states. And then it becomes even more rampant, and this is in the 2007 to 2009. It's even gotten worse up to 2012.
Okay. With seeing all of your patients, what would you attribute that to? Is it simply the whole supersize me thing, or is it?
It's a combination. You know, most people describe stress, and I always tell them stress has no calories. It's what we do with the stress, and it's everything from inactive lifestyle. It's you know, disease processes. There's a lot of medications out there that cause weight gain. It's injuries. It's the low lifestyle activity of driving everywhere when you could walk a half a mile to the grocery store. It's the sedentary lifestyle, not to mention genetic predisposition. And that a lot of people give a lot more credence to that when it's only maybe 5 to 10%, but then it is the supersize me. It's the dense calories that we're getting into that we really don't realize. And that's called food and liquid amnesia. Okay. It can be really dangerous.
And talk about a pretty sobering number, about the number of deaths in the United States every year from this.
Exactly, 400,000 deaths per year just with on their death certificate complications secondary to obesity. Okay. And so it's becoming a really rampant disease process.
Yeah, and that's one of those statistics that a lot of people say that the different diseases that are out there, or when there's you know, social society problems where people die from certain reasons that there's an outrage about. That if this were something else, if this 400,000 people dying from a plane crash, it would be absolutely amazing.
It would be stopped in one day, and it's really costing now billions in the medical healthcare as well as in the industrial workforce for it to be an issue of major complications for the cost of living in this country.
You're watching North State Health, the North State's first local health program.